To begin with, can you tell us a bit about your journey? I know that you've been through a lot, ESPN, American Cancer Society, Catalyst Group, so very diverse. Please tell us a bit about your journey.
Sure. Well, let me just start with, I am Venezuelan and Italian. So, and I grew up in Latin America. And so obviously my journey really is an international journey. I've worked mostly in the United States, but in international markets. So I don't have a lot of clarity about what happens in Chicago, but I can tell you a lot about what happens in Sao Paulo. So that sort of, when I was deciding on my education, I had an international relations and econ degree from Tufts University. And then I went to Wharton School of Business. And really that idea of having an MBA was because I really see the private sector as a primary stakeholder for solutions for low and middle income countries. You know, talks about the government, they talk about the nonprofit sector, but really the solutions are going to come from the private sector because solutions generally are profit driven, right? So my first job out of graduate school is I worked at the United Nations in some scale lending programs. And then I went to International Planned Parenthood and worked in their private partnerships department, contraceptive sales. So the idea was that we would sell contraceptives at a profit to be able to help fund the nonprofit work. And it was very, very interesting work. But unfortunately, I'm a very fast-paced person. And how it turns out is that the pace was not for me. So I started to look around. I got to an age where I'm like, okay, Wharton grad, but you can't still be talking about your Wharton grad, being a Wharton grad when you're 40. I think now, time for me to go back to my roots as a private sector person. And I started to interview around, and someone said something that I was very interested in. I said I was having a problem with the pace, and she was like, well, look, in the private sector, the slowest pace is in consumer products. The faster pace is in financial products, and the fastest pace is in communications. So then that's which I thought was a really interesting way of thinking about things. And I was like, okay, I'm gonna go for the nonprofit space, which is obviously the slowest of the slow. So I started interviewing in the communication space, and I got a job in the international department of ESPN, the sports network. We had 21 sports networks internationally, and I was their VP of marketing for all 21 of their sports networks. Obviously that helped create a media background, between like public relations, the communication strategies, but then also really the hardcore marketing strategies in these markets where we had really tough competition, because outside of the United States, ESPN isn't really the only game in town. Brought my skill level really very far up. I was there for 8 years. I really enjoyed it, had a great team, whatever. Then I started to think, I came to my second midlife crisis, and was that I had children, and I was like, I don't know if I care enough about sports marketing to be leaving my child at home. And so I literally said to a friend, I was like, hard leaving my kid at home. I'm not even curing cancer. And she said, oh, I know someone at the American Cancer Society who's looking for someone who can start a global department. And so I went over to the American Cancer Society, and after we did a lot of, things like market assessments and, figure out what was happening in different countries when it came to cancer, civil society. And so then we really started to focus on advocacy. And for me, advocacy is marketing. There's really no difference. Marketing is for a product, advocacy is for a cause. And so that wasn't a huge stretch for me. And I really enjoyed that work. We did a lot of capacity building. We did a lot of working directly with different governments, the United Nations and whatnot. And really, in 2011, what our big coup de grace was that the United Nations finally recognized cancer as a global issue that needed to be worked on. At that point, I felt like, okay, well, I've done what I can at the American Cancer Society. I'm going to go out on my own. I loved the work. I was sick of the place, and I knew that the people who were giving us money because of me. So I decided to take that and go on the outside, but continue doing that work. So Catalyst was formed in 2013. with a core group of what we called catalysts, people who I had worked with, who I just thought were like real change makers. And we specifically in civil society, getting civil society, patients, people with lived experience engaged in policy change, mostly in low and middle income countries, exclusively in the non-communicable disease space. We don't do anything with infectious disease. And the overarching vision is that the people who are the closest to the problem are the closest to the solution. So we have to work at getting them engaged in solutions. And but I've been doing, a great team ever since. And we, so that's where we are now. And I'm really interested in diving deeper into our work with patient groups and recommendations with patient groups, especially in the media space with you.
Yes, so fantastic, because what I see is will to always create impact, right, from wherever you're coming. And very, very interesting and rich journey that you've just, of course, very quickly, because I know that there is a lot behind that. But I was, how work that you do with patient groups, patient associations now from Catalyst has, with the media engagement strategies, the communication plans that you used to see throughout your career. What can you tell us about this?
So going back to that idea that marketing is advocacy, and so the way I look at media engagement when I'm working with patient groups is like I'm looking at how they can change the conversation, right? Just like at ESPN, we wanted to change the conversation to what we had on TV. It's the same skill set. But really what the key with working with patient groups is that they have access to the human story, which most journalists generally don't have, governments don't have. And the importance of the human story is that it transforms private stories into a public conversation. Mm-hmm. And the only way that you're going to make any sort of change in policy is by making public conversations, generating public conversations about things that have a human impact. Also, putting a human face on a problem makes it less abstract. So, are very, very fortunate to have a whole range of stories that they can share with the public. Making it less abstract, it helps demonstrate specific barriers in healthcare systems, right? So it's not just like a cancer story. It's a cancer story about delayed diagnosis or no access to medication. And so the human story can really pinpoint things that are failing in the system. Just having patients and people with lived experience out in the market helps build momentum. It can create more education for the public, and having the public talk about health issues, it starts to generate pressure on policymakers and the government, because government's never going to change things because they want to change things. They're always in democracies, they're going to be changing things because they're getting public pressure to do so. I think we saw that a lot during the pandemic. Was all of a sudden a lot of people who were taking their health systems for granted realized like, oh, I don't have access to this and I don't have access to that. And all of a sudden they were starting to think analytically about their health systems, which in a way was an opening of a door that I think a lot of countries needed to have. Also, but they're in the being out there in the media helps build coalitions and connections. And really on the granular level, a patient who has spoken to the media or is engaged in the media or has some sort of media savvy, by definition, becomes an empowered patient. Told their stories and it's been successful, and all of a sudden they feel like they have something powerful to share. And an empowered patient is the beginning of policy change. And so it's a very interesting journey to make this transition from like pure to advocacy, but really the themes are almost identical. And it's really about creating that groundswell to bring around change and making sure that who are benefiting from the change are the people who have the problems themselves.
Yes, you're correct. The human part of it is the strength, right, of any advocacy story. And also, evolution coming from large institutions, not just ESPN, but also the American Cancer Society, which is a very large institution. How her perspective on media strategy evolved, those large organizations to now helping other smaller size. There are some big patient organizations, of course, but the majority of them are medium to small size. So what's your perspective on that?
So it's interesting. I'm in a big organization. Media is a known stakeholder, right? You have to work with the media. You have to have strategies around the media. And for me, it always sort of seemed like common sense that that's obviously one of the groups that you want to be engaging with. But my mother always said, sometimes common sense isn't so common, right? And so there's plenty of times that I've worked with patient groups who are excellent in serving patients and actually really have very close contacts with government, but don't understand why they keep hitting brick walls. And then I will say, like, well, media strategy. And they're like, media strategy? Well, every once in a while they call me for an interview and I give an interview. And I was like, well, that's not a media strategy, right? It's a reactive strategy. And so that idea of opening them up to understanding the media as a way of not hitting as many brick walls when it comes to advocacy. Right. That's what we find is like, that's ultimately it's the last thing they think about, and they think about it for all the wrong reasons. And so that's been a challenge, but it's a challenge that has been enjoyable to work on, but it's something that you're really seeing a lot more change over time too.
Right. So more professionalism within the space, right? All right. So and making truly heard and an effective campaign. What's the secret sauce to make it all work? How you present this?
So I think that the first thing about creating, I'm going to get into the nuts and bolts of like specifics of what groups should do, but I want to just do like a beginning, and we'll go to later questions. I'm sure it'll come up to be more specific. But the most important thing is authenticity. And, the patient group has to understand that when they are engaging with the media, they have to be authentic to their own mission and to the patients that they're serving. And so I think that sometimes because strategies are reactive, patient groups sometimes aren't as strategic and aren't as authentic in their outreach to the media. Also, very important to create equity and diversity in the spokespeople. So, oftentimes the media will reach out to doctors who have tons of patients that they could talk to, but doctors are just sending a patient. When a patient group engages on a media strategy, they have to think about, like, are we telling a variety of stories? Are we representing different income groups? Are we representing different racial groups? Are we talking about the cities and the rural areas? And so that's where you get sort of the more nuts and bolts, the bigger strategy thinking. And it's very important to co-create with patients. Just be representing patients. The patient group shouldn't have a media strategy, and then when they need a patient, they go and they choose a patient. It's like to be working with patients on creating the strategy. What are some things that the patients think are important to be out in the public? And so that co-creation element is super, super important. And honestly, like, one of the things that I think everyone doesn't do well, but certainly patient groups don't do that well, is measure impact. And so making sure that after the strategy has been rolled out, that you're looking at clippings and you're looking at, behavior and understanding. And the measurable impact is super important. And obviously that's ultimately what will beget you.
Right. So specific technical issues, if I might say, like the framing, defining the audience, also timing, as you will know. But they also mentioned the human aspect of the story. So everything has to be together. It's a strategy, a good strategy to deliver those messages. The coalition aspect of it, or other stakeholders.
Right. When you're saying partnership, do you mean from the patient group side or the corporation side?
The patient group side.
Yeah. And coalitions is the key to making sure that that media strategy is consistent and powerful, because there are just not that many patient groups that are big enough to lead and continue with a comprehensive media strategy. So generally, when you're working in a coalition environment, you're finding that there's certain groups who have certain strengths in terms of information. They might have better spokespeople on different topics.
Sure.
And where like you always have to put your ego aside, because of course everyone always wants to show up on TV, right? And everyone wants to be a person, right? But you really have to think analytically about like, who has more access to different stories in this area, that area, and who are the best communicators, and why are those stories important? Because what you often find is that people get stuck in their story, right? They sort of have founder syndrome. It's like a 32-year-old woman who was diagnosed with type 1 diabetes at 7 years old, and that was traumatic. And yes, absolutely, that was traumatic. But the diabetes story is so much more complex, right? It has issues around access to medication. It also has the whole world of type 2 diabetes that is very linked to obesity. And it's very important to be able to pull back and say, yes, I am a story, but I need to create a strategy to address a bigger issue. And that's when in a coalition can be very helpful, because they're just by virtue of having more voices, the conversation is going to get larger.
Right. Then there is also the timing, and when you see some patient groups going out and there is a crisis, for instance, or whatever, so they go out to the media and they express themselves. But there are other ways to engage with media and journalists that can be more sustainable for patient organizations.
Right. So that is actually one of my biggest gripes about patient groups, is like they really only start talking when there is a crisis, right? Or when a celebrity gets diagnosed with the disease that they're working on, or a law is passed. And by the time a law is passed, it's generally too late, right? So when I'm working with patient groups, I try to come up with really, really specific ways that you can build out your media strategies. First of all, establish relationships, not just contacts. You don't just want to have a list of newspapers and the journalists within the newspapers, or websites or bloggers, or super important, Twitter as well. You want to be able to have an ongoing relationship with all of them. And sometimes not even about only your issue. You sometimes take yourself out of your own specific issue, because a problem that another disease might be having can also be reflective of some of the barriers that your own organization has. Another thing that we used to do that I'm often surprised that patient groups don't do is we used to have what we called our patient spokesperson bench. And what that was it depended on the quantity is almost limitless, but we would divide it up in terms of barriers. So there's barriers to access to medication, or to screening, or to education. So we'd have trained spokespeople for each one of those, male and female. Then we would have regional spokespeople, but obviously access is very, very limited, is very specific to the region. And then we would also make sure that we had and demographic groups. So it literally, when we started this, it was literally a box of file cards, right? Now it's a little bit more sophisticated, but you could pick. You'd be looking at what was happening out there, and you're like, oh, we're coming up on a screening issue. Here are 4 screening stories that I can pitch to the media. And also thinking through the media calendar, right? There's certain times a year where certain issues around health are discussed more. You have to be prepared for that. And to the media, that they're very important in terms of being policy watchdogs. So they understand they're a little bit more as well. It's like, we're just going to be talking about, to talk about heart disease. We need to talk about heart disease because our government is failing to meet the needs of people with heart disease in our country. And I think one of the things that now patients might be underselling themselves around, because it used to be that we'd bring the patient voice, and that's what it was. So that's really a content support to the media. Now we're really entering an area where we are also bringing eyeballs, right? And that's also a way to build relationships. Retweet someone's article, and comment and a paper. There's ways of that helps build a relationship, because ultimately every journalist wants to have more eyes seeing their stories. And that's something that as we develop our our feeds and our blogs and our Instagram and whatever is going to come next, because these are all going to be outdated in the next 5 years, we are also a way of them communicating to a larger audience. One of the things that, and then I'm going to stop on this because I could ask all day and I shan't. One of the things that I think is really an area where it's a huge gap. No one is doing this. And really, patient groups are the key to doing this well. And we used to do a lot of these at the American Cancer Society. And now when I'm working with international NGOs, I work with them on this too. Journalist trainings. Journalists have very little access to information. They have public access to information, obviously. They're not doing a lot of homework because they have to, oftentimes a health journalist is also covering, design or other things. Like, it's rare that you find a journalist that's only doing health, and they don't really have a health background. Yeah. And in some cases, they're not even interested in health. I mean, I joke around that it's like at ESPN, sports journalists are obsessed with sports, right?
That's true. Yes.
Happiest people in the world because they're a sports journalist. They might not be the smartest people in the world, but they're definitely the happiest. And then I go into the health space and it's like, care, don't really care. No, they don't really know. And so just good, it can be a 1-day training or a 4-hour training. It can be on Zoom, and it can be in person, but giving them access to experts, patients, and information. Those are things that most journalists don't have access to. And it's a wide open space that both groups and actually corporations should be thinking about.
Great, that's a very, very practical advice, and I totally agree with you. Just going back a little bit to a corporate perspective, corporate affairs, support patient organizations, etc. How can they help to create compelling and legitimate narratives? Because that's the issue, right? It's important that these organizations remain credible in front of their audiences, and they have their independence. So how can create strategies towards patient groups, knowing that there is not an equal weight?
Well, just like I was saying with groups, that they have to have a consistent relationship with media outlets, corporations have to have a consistent relationship with patient groups. One of the biggest complaints from patient groups is that companies fly in and out depending on what they're going to launch in the market and when. So you'll have a very close relationship with a company for 3 to 4 years, and then they absolutely disappear because their product is launched, it's been approved by the government, and the patient group is then, so that's one of the things, is like this conversation. And then, you have to make sure that you're showing consent and respect. Sometimes I feel like patients will be involved on like giving their testimonial or being filmed with a story, and then it's used and the patients aren't even really clear on what it's been used for and why. And feel, people, and they're not props. So you have to really prioritize dignity, right? And again, back to the diversity, show a diversity of race, gender, geography, age, so that the story is a little bit more compelling. And ensure that you're showing patients in an empowered way and not as victims, because a lot of the testimonials you'll see as victims. And so those are my criticisms, and some of the solutions for that are making sure that you're working with the patient group in a co-creative way, right? And storytelling might be bigger or different than what you're trying to achieve, okay? So you might be looking to get a product launched that's for atrial fibrillation, right? But the story might need to be bigger than atrial fibrillation in order to create the dialogue. And so sometimes find that corporations are just so focused on their bottom line and focused on their product that they're not creating the larger story, because without a larger cardiovascular disease story, no one's going to know what atrial fibrillation is, and no one's going to care, right? So you have to make sure you're following the audience where they are, and the patient groups where they are as well. Also, ensure that you're working together with patient groups as they're creating social media campaigns. Social media campaigns can be very low cost. They're excellent ways to get the patient groups out into the media. They're also wonderful things to support because they don't cost that much money and they can have a lot of impact. And trying to create environments where patients are involved in corporate discussions. So that could be, so that can be patient advisory boards, but you want to make sure that patients are involved. And this is, I know that I'm preaching to the converted, because if you're listening to this, you already know this. The patients really have to be there from the beginning to the end, right? And we're talking about media strategies, which tend to be more on the end point, but the relationships have to come well before the media part of it. Because if a patient or a patient group is only involved when it comes to using their story or using their social media platform or engaging with the media, that's when they start to feel a little used. So, so long-term, it's the long-term engagement. It's the consistent engagement.
Consistency, yes.
And then it's the engagement in a lot of different ways, so that they're not feeling like the groups are being used only for one thing, and that one thing is very public facing. Because the reality is, like, patients are the consumer, right? I know that the way the healthcare is set up, they aren't the consumer. But if you were selling a Toyota to a person, that person is the most important thing. And you would have a lot of insights into that person because you're trying to sell them a car. That's not how it works in health, but it really is what we should be transitioning towards.
Right. I know that you've already given a lot of advice, different strategic and specific, but maybe I can ask for a last advice that you can give, coalitions, patient groups, towards more strategic media engagement. What would you say?
Map media. When I was at ESPN, we knew every media outlet. We knew their strengths. We knew their weaknesses. We knew the context. We knew what they were interested in and what they weren't interested in. So that we always knew who to touch and when, right? And so by mapping your media outlets, you still have to think about legacy media. Obviously, you need to think about social media, but you also need to think about influencers who might, if you're talking about health, you should be talking to health influencers who normally are talking about supplements. And you might know that supplements aren't really the answer, but you can engage with them on a larger conversation, right? Mapping the media, making your media map very, very widespread, and making sure that with that media mapping, it's the beginning of a conversation and a consistent conversation with them as well. And that you're not always just pitching a story. You're talking through things with them. And again, like I spoke to before, you're promoting things. When they do something good, you're going to promote that. So you're a bit of a partner too. And the important thing with patient groups and media, like in the ideal world, a patient group is seen as a way of amplifying the message because they're doing that retweeting, reposting, everything. They're seen as human story content because that's really what is like the potatoes to good media coverage, but that they're also seen as experts, and experts on scientific content, on advocacy, on government relations, on the patient journey, experts that they have expertise that they can share with journalists. And so that means, and then obviously they have to be fast. I mean, one criticism I can give to patient groups is not fast. They'll get the phone call and then they'll spend, which to them doesn't seem like very much time, they'll spend 24 hours trying to come up with the story. You don't have 24 hours. You might have 24 minutes, which is why you want to have your of stories. You have to understand the issues, and you have to understand what stories and what people can tell those stories. And so I think that by mapping media outlets and by having conversations in a non-stressful, non-pitch environment will give you a lot of insights into what the media is looking for, when and how. And that's ultimately what you're going to need in order to create a good media strategy.
Right. That also brings us to the beginning of the conversation. We were talking about being fast-paced, and of course, the communication sphere is frenetic.
You have to respect that. You have to know where they're coming from. I mean, put yourself in their shoes, and that's true also from a corporation standpoint. You have to put yourself in the patient's shoes or the person with lived experience shoes to understand what their touch points are. And so ultimately, it's just about more of a feedback loop, almost like everyone needs to understand each other a little bit better and engage in spaces that might not be as self-serving all of the time, but that will ultimately create a better relationship and better outcomes over the long term. Because obviously corporations, patient groups, and the media are all working for the same thing, and that's societal change. And that doesn't happen unless you have a multi-stakeholder approach.
Sure, that's the basis of stakeholder engagement. Thank you so much, Alessandra. It has been really, really insightful as usual, and I'm really glad to have you audience. Thank you so much.
Thank you for the invitation.
All right.